Atrial fibrillation is an irregular rhythm that comes from the top chambers of the heart. Atrial fibrillation can cause symptoms of palpitations, which patients describe in various ways, but they can be irregular heartbeats or fast heartbeats or skips in their heartbeat. So that's one kind of sensation. But patients can also have sensations such as shortness of breath, fatigue, and exercise intolerance. The biggest risk, or the most important complication that can develop from atrial fibrillation, is stroke. And the reason why patients with atrial fibrillation get strokes is that when the top chambers of the heart don't beat right, then blood isn't flowing through the heart the way it should. It starts to pool and stagnate in the upper chambers, and then blood clots can form. And if those blood clots break off, they can travel straight to the brain, and then they can cause a stroke that way. Atrial fibrillation increases the risk of stroke by 500%, which is an enormous increase of risk. When patients have atrial fibrillation and they're at risk for stroke, we give them medications that help thin out the blood so that we reduce the risk of stroke. There are a number of medications that are out there to treat atrial fibrillation and prevent strokes. So one example is warfarin, which has been around forever. Warfarin works, we know it works, but the problem with warfarin is that the dose has to be adjusted based on blood tests. Very recently, there's been at least one drug released for prevention of strokes in atrial fibrillation that is taken twice a day, doesn't require the blood test monitoring, and also doesn't have the food and drug interactions that we've seen with warfarin. There are two kinds of drugs that we use to manage the symptoms that are related to atrial fibrillation. One kind is what we call rate control or heart rate control. So if a patient has atrial fibrillation and their heart's racing at 140 beats a minute, that's one reason why they would feel bad. So we can use medications that'll help slow down the heart rate, and then that'll reduce symptoms. The other kind of drug we use are called rhythm control medications or antiarrhythmic drugs. Beyond the use of drugs for atrial fibrillation, there's a procedure called catheter ablation. So for patients who have had recurrences of atrial fibrillation, despite the fact that they've been on some medications to help control it, we can do a procedure whereby catheters are put up into the heart, and we get over to the area where the atrial fibrillation impulses start from. We can take catheters and burn around the openings of those veins to prevent those impulses from getting into the heart. I'm Dr. Ann Curtis. I am the Charles and Mary Bauer Professor and Chair of the Department of Medicine at the University of Buffalo.